And again, for the sake of time, I'm going to move on to the next presentation, but there is a question in the chat. And so if you could answer that, thank you. So it gives me great pleasure to introduce Dr. Eve Valera, who is going to talk to us about concussion and intimate partner violence. She is an associate professor in psychiatry at Harvard Medical School and research scientist at Mass General Hospital. And she's worked in domestic violence for over 25 years using a range of methodologies to understand the neural, cognitive, and psychological consequences of brain injuries from intimate partner violence. Her most recent focus has been on transgender women. She regularly lectures internationally in South Korea, France, Colombia, and Canada, has received national and international recognition, interviewed by major news agencies and magazines. And within the past 3 years, she's been the recipient of the prestigious Robert D. Boyd Founders Award, Rappaport Research Fellowship in Neurology, Pink Concussion's Domestic Violence Award, and the Anne Klemansky Visiting Scholars Award. She's passionate about raising awareness and educating all relevant stakeholders about this tremendously overlooked public health problem. And so I leave you in Dr. Valera's hands.
Thank you so much, Carmela. And I want to really extend my deepest gratitude to Drs. Tatter and the Canadian Concussion Center for inviting me here. It's been a pleasure speaking yesterday, and I know I've been here a few years ago, and I really appreciate the fact that this group has recognized partner violence as being something that's really important to talk about in the context of concussion or brain injuries. And it was a little bit ahead of its time because not a lot of groups realized it way back then. I think it was in 2017 or so. And it's being a lot more recognized now, not nearly the way it needs to be, but nonetheless, thank you so much for inviting me here. And I'm really honored to be able to present here. So I'm going to share my screen. And we should be good, correct? Everyone sees everything okay, correct? All right. I'm going to assume that's a yes. So again, thanks everybody so much for joining. And I do want to say that the topic I'm going to talk about is not pleasant. So concussion isn't pleasant, right? But partner violence is particularly unpleasant. It doesn't happen from an accident. It happens from somebody deliberately trying to hurt another person. And if I can see that there's about 80 people out here, I know that even though we often think we don't know anybody who has experienced partner violence, that it's very common. And so I'm likely talking to at least a handful or more of people who've experienced some type of partner violence. And so this might affect you in a certain way. And I'm certainly open to and happy to have a conversation afterwards if anyone would like to. But it isn't a fun topic. So let's see, just here we go. Okay, in IPV or intimate partner violence, simply put, is violence perpetrated by a current or former spouse, partner, significant other, boyfriend, or girlfriend. It doesn't matter how long that relationship is. It doesn't matter if you're married or anything like that. If you're in a relationship with them, they hurt you, perpetrate violence against you, it's IPV. And IPV is a subset of domestic violence, which also involves child abuse and elder abuse. Abuse that occurs within the home. Some really terrible facts about IPV are the following. IPV is the leading cause of homicide globally, and IPV is the most common form of violence against women. So I just want you to think about that for a moment. If you were to hear that any woman was murdered or was violently attacked or injured again from someone committing violence against her, and you could only pick one, you had one guess as to who it was, your best guess would be her partner. And this I find to be just horrible and wrong, and this should never be the case. And we need to recognize that this is the way things are. Okay. And once we recognize this, we'll be in a better position to really believe everything that I'm going to tell you today in this presentation. Intimate partner violence is found across all socioeconomic boundaries as well. It is not just the people over there. It is not us versus them. It's not people of color, Native Americans. It is everybody. I mean, there are no groups that are excluded from intimate partner violence. It is genuinely a global public health epidemic. So exactly what does this mean? Well, 1 in 3 women experience physical or sexual intimate partner violence globally. 1 in 3. If you look at the map, there are some places that are quote unquote safer, some places that are less safe. So sometimes the numbers are higher. So it could be almost 70% for some women, for some countries. And in the United States, it might be, depending on the numbers that the epidemiological data that you look at, it could be 1 in 4, but 1 in 3 is pretty reasonable. And I'm not sure exactly what it is in Canada, but it's probably 1 in 3 or 1 in 4. And so what I want you to do is I want you to think of 9 women that you may know. And then I want you to think of which 1 or which 2 or which 3, because it's going to be one of those numbers for sure, have experienced some type of physical or sexual partner violence. I can practically promise you that if you know at least 9 women, you know probably 3, maybe 2 or 1 women. Because by the numbers alone, if you don't, it's very exceptional. And the reason I say this is because partner violence is very stigmatizing. People don't want to talk about it. It may have happened in their past. Maybe it's still ongoing. And it's hard to say, yeah, I'm in this relationship and he beats me up. He hits me in the head for no reason. He, burns me for no apparent reason. And yeah, I'm still with him. There are a lot of different reasons people don't talk about partner violence. And so just because it's not talked about doesn't mean it doesn't exist, and it does. So the reason I say this is not to basically say, oh my gosh, like we're all living in this horrible place where partner violence is ongoing. I mean, we are, but I really want this to hit home with people and recognize that the people I'm talking about here are our daughters, our sisters, our mothers, our colleagues, our partners, our friends. These are not people that we don't know. And just because we don't ask doesn't mean we're not, that it's not happening. Unfortunately, in partner violence, 80-90% of violent abuse to women injures the head or neck. I've had people tell me about being stomped on the head with work boots, hit in the head with fists, hit in the head with hammers, and hit in the head with baseball bats. Women who experience IPV also report high rates of cognitive, physical, and emotional problems. Now, for those of you in this audience, I'm thinking most of you are concussion or brain injury folks who recognize these symptoms. They look like post-concussive symptoms. And it's because they are. Women who experience partner violence exhibit some of the same exact symptoms that people who report brain injuries exhibit. And so when I started doing this work about 25 years ago or so, something like that, I recognized this connection through volunteer work I was doing in the shelter. And I said, wow, my gosh, this is terrible. What do we know about this? And there was nothing. And to this day, there's very little. There's more. But when you compare it to what we know about sports, athletics, and brain injuries, or military and brain injuries, it's really nothing. And so I'm going to talk to you today about some of the data that I have collected, some of the findings that I have. And there are other folks who are doing this research, thankfully, but we really need to increase awareness and increase attention to this topic. What I found in my data was that most IPV affected women in the United States sustain IPV related brain injury. What I have here is this 42 million women. That represents the number of women who, by that 1 in 3 estimate, have experienced sexual or physical partner violence in the United States alone. 42 million women. Okay. And in my sample of 99 women, what I found was that 74% of them experienced at least one IP-related brain injury. That would translate into about 31 million women if we were to extrapolate. What was even more disturbing was that about half of these women reported repetitive brain injuries from their partners. Repetitive. It might be that there was 2 or 3, but for some of these women, the brain injuries were simply too many to count. It might be this happened once a week for several years or something along those lines. Now, I will grant, and I always say that the extrapolation of these data to, the United States is not epidemiologically sound by any means. So I have a sample of convenience. These numbers could be inflated, but even if you're going to cut these in half, that might be 10 million women with repetitive brain injuries, or let's just say even half isn't enough. Let's go down to a quarter, 5 million women. No matter how you slice it, the number of brain injuries that these women are sustaining is incredibly high. And especially considering how little we know about it, this is a tremendous public health problem. So what I also found in this study of sample of 99 women is conducted in the United States was that the brain injuries or brain injury score that I created was related to poor cognitive and psychological outcomes. High brain injury scores were associated with poor performance on tests of memory, learning, and cognitive flexibility, and higher ratings of general distress, depression, worry, anxiety, and traumatic stress. This was not accounted for by abuse severity, psychopathology, or substance abuse. So historically, when women who had experienced partner violence were seen as having problems with depression or anxiety, or having problems, focusing, or they seemed like they couldn't process information or remember or learn things. It's like, well, of course, they're in this horribly violent situation. It's because of the abuse. Or maybe it's because these people are strung out on drugs. And the answer is no, because I did control for that in my data. Now, since then, I conducted another study that's currently in press, actually, at Journal Petrum Rehab. And we looked at IPV-related brain injury in Barranquilla, Colombia. So a little place in Colombia, because we want to see if this would, we need to do more data cross-culturally, data collection cross-culturally, and we want to see what we would see in another culture. And what we found was the prevalence of IPV-related brain injuries in Colombia, using the measures that we used, was 31%. Now, this could be a systematic data collection difference or something like that. But the point here is we still have very high rates of brain injury. So ultimately, what we see is that, and there's another paper that we actually have under review, and the rates of IPV-related brain injury range from like the mid to high 20s to 100% in the samples that have been studied. So this isn't just some chance thing that we're finding. This is really happening. And similar to what we found in the US study, when we looked at the relationship between the brain injuries from the women in Barranquilla, Colombia, and cognitive psychological functioning, we found that brain injury scores were associated with poor performance on tests of long-term and working memory and cognitive flexibility. And there was a borderline association with depression. And again, we don't know if this is a cultural difference or just the measures that were used or whatever, but certainly cognitively, we're seeing this relationship. And psychologically, we'll need to do more data collection. It's not accounted for, again, by abuse severity, C.E.T.S, educational status, or substance abuse. These are real effects from brain injuries. I want to take a couple of minutes to talk about brain connectivity. And for those of you who aren't necessarily familiar with imaging, as I wasn't before I started doing this a little while ago, we use MRI like this to measure brain connectivity. And there are two types of brain connectivity that we look at. We look at structural connectivity, which involves parts of brain cells that connect different brain regions. And we look at functional connectivity, which just involves regions of the brain that are working together, but are not right next to each other. Okay, so we look at this because we know that both structural and functional connectivity are critical for optimal brain function and ultimately for behavior. And what we also know is that traumatic brain injuries, or brain injuries more generally, involve injured brain cells that affect structural and functional connectivity. So, and this may be obvious to a number of you, but just to illustrate, in the brain, we have neurons, as I've depicted here. And the neurons have a long axon, and that axon is thin, and it doesn't take a lot to potentially damage that axon. So when we have traumatic shearing, we may shear this axon when we have traumatic forces, such as acceleration, deceleration, or rotational forces, we may shear or break, damage that axon. And so then you have a neuron that's maybe damaged. And so it may not communicate the way it should, or it may not communicate at all. And the axons, although they are plentiful in the brain, they're tiny. And so if you try to use an MRI scanner to actually look at damage on a regular scan, say you have someone get a CT scan or someone after a concussion, you don't see anything, because what we think is going on is largely, or partly, because there's a lot of other factors too, diffuse axonal injury. Diffuse is all over the brain, axonal affecting that little axon and injury. So it may happen in various regions of the brain versus like these focal injuries that we can really see if we have a moderate to severe brain injury in many cases. We know that neural networks need to work together for efficient cognition. And this is where we're talking about functional connectivity. And so these are two examples of networks that we need. There are many other networks in the brain, but we have the salience network, we have the default mode network. And this region over here, the anterior insula, is very important for coordinating communication between these two networks. And we know this because we can study it, and we can see that the communication between these two networks increases when somebody is doing a cognitively demanding task. But what was found by a group headed by Sharp and colleagues in the UK was that when brain injured folks did a cognitively challenging task, there wasn't that same increase in communication between these two networks. So what we did in our study was, can we see this in a sample of women who have experienced partner violence and partner IPV-related TBI? And so we looked at that. What we found was that indeed brain injuries were associated with network connectivity, which was associated with memory and learning. And so just to put this very simply, we basically saw that the more recent and the greater number of brain injuries a woman had, the less positively those two brain regions communicated with one another, the anterior insula from the salience network and the posterior cingulate precuneus from the default network. We also found that the less those two brain regions communicated with one another, the worse women tended to be able to learn a list of words and remember that list of words 20 minutes later. When we looked at structural connectivity, we found that IPV-related brain injuries were also associated with structural connectivity in the posterior and superior coronal radiata. Now, we had a small sample, so we don't look at the whole brain. We basically use some data from a repetitive brain injury study in football players, and we focused on three regions, the posterior and superior coronal radiata and the posterior thalamic radiation, illustrated here. And we basically looked to see if the number of brain injuries women had sustained might be predictive of fractional anisotropy, or the way water is moving inside the axons in these brain regions, in these white matter brain regions. And we did find for two of the three regions, the posterior and superior coronal radiata, that it was indeed the case, that there was a negative correlation between the brain injury score and fractional anisotropy in those two regions. The next thing I want to talk about is strangulation. Why do I want to talk about strangulation? We're talking about concussions here. We're talking about brain injuries here. Well, strangulation is a serious form of abuse that can cause an acquired brain injury. Strangulation is not choking. If I'm speaking to a woman who's experienced partner violence, I will not say, oh no, you can't use that term. Absolutely, that is 100% okay. But in an academic setting, in a setting where we want to really say what it is, we don't want to say it's choking, because choking is when you have something lodged inside your throat. It's often accidental. Strangulation is an external attack on the neck. And it involves things such as things that involve deprivation of oxygen. So we have asphyxia, which is depriving the body of oxygen, which can lead to unconsciousness or death. And then we have hypoxia and anoxia to describe other things that may happen. When you have hypoxia, you have partial loss of oxygen to tissue. And when you have anoxia, you have complete absence of oxygen to tissue. And when you have hypoxic or anoxic incidents, as you can imagine, you may have cell damage or death. And strangulation is a form of asphyxia from external pressure placed upon the neck, such that there's an obstruction of blood flow either from or to the brain via the jugular vein or the carotid artery, or an obstruction of the airway. And so if you look over here, what we see is that we have on the lateral sides of the neck, we have blood that has been used, right? And is leaving the brain. And if you press on the neck, you can actually occlude or block that vein very easily so that you can have increased intracranial pressure because you have blood going in, but you don't have blood going out because you have blood going in via the carotid. Now, if you press a little harder and then you're blocking both the jugulars and the carotids, now you don't have that problem, but now you don't have oxygen-rich blood going into the brain. So now you might have some type of anoxic or hypoxic incident. If you press even harder, then you may block the trachea, the airway here, and you don't allow basically air or oxygen into the body at all. So it is actually remarkably easy to cause brain damage, potentially, if you are strangling somebody, because it doesn't involve just a crushing of the airway or something like that. Blood buildup or lack of enough oxygen from strangulation can cause damage quickly. Blood buildup can cause unconsciousness within 2 minutes. Anoxia can cause unconsciousness within 10 seconds. And strangulation can cause brain death while leaving no external mark. So I just want you to think about that for a moment. Women have told me stories of how paramedics said, the woman said, oh, he choked me or he strangled me, whatever the term she may have used. And he said, oh no, you couldn't have been choked because I don't see, your neck looks fine. But women have literally been murdered. And if you look at their neck, you don't see anything. So this is another example of an invisible injury that we may refer to, in women, similar to what we see in brain injuries that are quote unquote invisible. Damage may result in death weeks later. So it is important to take into consideration strangulation, because even if you think you're okay, other things may happen that sort of unfold after the incident if there's damage that can ultimately kill you. It's not necessarily terribly common, but it can happen. So rates of strangulation actually vary depending on how it's measured quite a bit. So the numbers are always high, but if you just ask a woman, did your partner ever choke you? In the sample of 99 women that I mentioned earlier, 86% reported at least one incidence of being choked. Now, if you ask it in a way that we're trying to get at whether or not an anoxic or hypoxic event may have resulted in an alteration in consciousness. So after anything your partner ever did to you, did you ever lose consciousness, feel dizzy, feel dazed, confused, have memory loss? 26% reported this after an incident of being strangled. And so what I did was I said, well, I wonder if we look at this, and I did this in, controlling for brain injury, traumatic brain injuries. I said, if we look at this and compare women who have been strangled and it resulted in alteration in consciousness versus women who hadn't, can we see differences or relationships between cognitive or psychological functioning? And what was just published recently in the Journal of High Trauma Rehab, we did show strangulation-related alterations in consciousness were related to long-term and short-term memory, depression, and PTSD symptomatology. So it is important to understand not only the traumatic brain injuries in women who are experiencing partner violence, but also the potential influence of strangulation-related alterations in consciousness in women who have experienced partner violence, because we don't know what type of additive or interactive effects may be there. The next thing I'm going to talk about really briefly is correlates of neurobehavioral symptoms in IPV. And why do I want to talk about this? Well, as I said earlier, there are a lot of symptoms that women report, women who have experienced IPV that report, that are very consistent with what we see in individuals who have experienced brain injury, right? And so in my field now, it would be very easy to say, oh, wow, okay, women have headaches, women have problems sleeping, women have dizziness, women have memory and attention problems, etc. And so this must all be related to brain injuries. And I don't want to make that assumption, because we know that neurobehavioral symptoms, or post-concussive symptoms, if you will, it's just enough, it could be the same term, but it's not necessarily from a concussion. They're very common in the general population. And so in this study, I just wanted to look at that. And focus on childhood trauma, because a lot of women who've experienced partner violence have also experienced childhood trauma. And what we found is that childhood trauma was associated with higher rates of somatic and emotional symptoms independent of brain injury. And this is really important to note, because this might be in part, in a lot of, in the next, in a minute, I'm going to tell you something else, but this may be related to the previous talk, and that what might help post-concussive symptoms persist, or are there other things that are factoring in here? And so this is important to know, because women who have experienced childhood trauma are going to be more likely to have the negative outcomes of brain injuries that they may be sustaining. And so basically, when we looked at it, it was specifically somatic and emotional symptoms that were related to the childhood trauma, but brain injury was also, independent of childhood trauma, associated with somatic symptoms. And we also noted that post-traumatic stress partially mediated this effect. So this is just, we're like barely touching the surface here. And this is not, by any means to say, oh, we know exactly what happens with neurobehavioral symptoms, because there have not been other studies that have looked at this way. But the point here is that when we're working with women who've experienced partner violence, there are a lot of different variables that we're going to want to consider and think about to understand what their outcome might be from the from the brain injuries, potentially repetitive brain injuries that they've received from their partners. These are some data that are not published yet, but I just wanted to take a peek. If we use the ICD-10 criteria for post-concussive syndrome, and we exclude women who had experienced a brain injury within the past 4 weeks, what I found was that 70% would actually meet that criteria for mild post-concussive syndrome, and 31% would meet that criteria for moderate to severe post-concussive syndrome. And again, these are unpublished data, but it's just going to show that these are women who are experiencing a lot of neurobehavioral symptoms, and women who have experienced as a whole a lot of brain injury, and we barely know anything about it. So next, I'm going to talk to you about COVID. Unfortunately, COVID are often trapped in a very dangerous and terrifying situation. And just for an example, isolation is one method of power and control that abusers use to keep their partners under their thumb and under their control. And when COVID came along, that was sort of like a perfect storm. Because women were basically locked down with their abusers. They don't have access to help anymore necessarily. And so IPV and COVID represented a clash of two pandemics, which likely resulted in increased levels of brain injury. We don't know, because we don't have pre and post measures of brain injury systematically collected. But the reason I think that there's probably increased levels of brain injury is because there was economic stress and uncertainty, loss of jobs, fear of contracting the virus, COVID mitigation strategies, which force people to spend more time together, which we know just by spending more time together, there's more partner violence. There's no place for women to escape. There's no place to call for help, etc. So rates and severity of partner violence increased during COVID. We have just the rates increasing globally. You can follow it sort of as you might follow the pandemic moving along the globe. And then severity of IPV in at least a couple of cases has been noted. So it's not just that there's more, but it's more severe. And actually, initially, there was less reporting of IPV, in part because it was hard to report, or there was fears about reporting it. And homicides or femicide increased in many sections of the world, and certainly reported since COVID started. So COVID mitigation strategies basically reduce women's ability to escape the violence and leave the situation, and has resulted in worse outcomes and situations for women who are experiencing partner violence. And if we want to say, oh, well, COVID's over, or maybe it's over, and I don't know, it depends on who you are, COVID's over. But we know that these types of things have long-term effects. So the effects of COVID are going to be long-lasting for at least another year or two, I would say. So what can we do? Well, start the conversation. There was lots and lots of articles coming out saying, oh, IPV is escalated since COVID. This is horrible. But what there wasn't was anybody saying IPV has increased, and we need to be really careful, because we want to make sure that if there's also an increase in IPV, we want to be checking for brain injuries, because severity may also be going up. there was no mention of brain injuries in IPV, even when people thought they were being really cognizant of the fact that we were doing a good job of recognizing this. And so I wrote this little letter, and ultimately, in terms of starting the conversation, COVID represents an opportunity to do that, because we can say, we know COVID has really made things harder for people to get along, made families, more desperate, so to speak. And I just want to check in with you. Are you okay? Do you feel safe? And so it's a way to help decrease the stigma and to open the conversation. Because the other thing that I want people to understand is that TBIs unseen behind closed doors, which are what brain injuries or TBIs are in partner violence typically, they're likely to be misinterpreted or missed. Because if you've just sustained a brain injury, you might look like you're disoriented, confused, distractible, inconsistent, uncooperative, dizzy, maybe even off balance. And these are all things that you might see if someone has just been using drugs, right? Using alcohol. And so if you don't see that hit, like on football players, soccer players, sports folks have this great advantage that there are often tons of people watching. So when they get up off the field and they look out of it and they're walking off balance, or they're dizzy, or they do weird things or whatever, it's not like, oh, what's this person? What drug is this person on? Whoa, what's going on here? No, it's obvious that they sustained a concussion, a blow to the head. But if you open the door and you see somebody who looks like this, that's not the first thing that most people goes to their head. Oh, they sustained a brain injury. No, it's okay. What's going on? This person is clearly out of it. What are they doing? And so this is sort of my plea here to say, don't make assumptions. We need to entertain the idea that brain injuries have occurred. And I also don't want to say that every single woman who's experienced partner violence is experiencing brain injuries and that's all her problems. No, substance abuse may be a player, but we can't make that assumption. We need to really put brain injuries in the mix here. So brain injuries make it harder for a woman to survive, to escape, and to keep her children. Having a brain injury may make it harder to assess danger and to defend herself against further abuse. May make it harder to remember and make safety plans. When I've talked to women who have experienced partner violence, and they tell me how they really wanted to get out of the relationship, but they couldn't, it really brings home the fact that it's not just like you pack a bag and walk out. Women have been stalked. Women have left, gone to a different state, and been found. And it's also the case that when women leave, that is when women are leaving or after they've left, is the most likely time for women to actually be murdered. So if you have a partner who tells you, I'm going to kill you if you ever try to leave me, well, it makes it a little more complicated. And if you're trying to get out of that situation, and it's not easy, and now you have maybe one or repetitive brain injuries on top of that, that might make it a whole heck of a lot harder. So this is really important. It may make it harder for women to go to school or be holding a job, so be financially independent. It may make it harder, as I was saying, to leave the abusive partner and live on her own, to access necessary services, maybe to get an order of protection, which is remarkably difficult to get in some places for some reason. I don't know why. Or to adapt to living in a shelter. Shelters are not necessarily a great place to be if you have a brain injury. There's a lot of things that do not work well. You have to follow rules. You have to live with a bunch of people who you may not know. There may be a lot of kids going on, a lot of noises, a lot of bright lights, a new schedule, things that if you know about brain injury and recently sustaining one are not good if you're trying to navigate. And all these things may ultimately make it hard to retain custody of her children. But the one thing I want to emphasize, that does not mean that a woman is unfit. I think most of the people here probably know this, that just because you sustain a brain injury does not mean you should not have custody of your children. But one of the reasons I say this is because there have been some attempts, or at least one, where somebody has said, you know what, as an abuser, my partner has brain injury, so I should have the kids. And as crazy as it sounds that no judge would ever give the kids to somebody who caused the brain injury, apparently it does happen, because if the abuser says, well, I went to my classes and I'm good, but she's still messed up, it makes sense, right? So my shout out to everybody is who should know this. And I say everybody: judges, lawyers, police officers, paramedics, nurses. Raising awareness is critical. Every person you know, because we want to destigmatize this and we want to let people know that this is going on. It's not okay. And we shouldn't be embarrassed, and we should want to talk about it. And we need to find out more about this. First responders need to understand that if they show up at a scene and someone seems disoriented, let's not assume the negative, right? Understand that, maybe they just sustained a brain injury. And maybe you should even ask about that. Court personnel, exactly. If a woman is telling a story and her story is sort of kind of going all over the place, I can't remember how I got from the bathroom to the bedroom. I really can't remember. The judge says, well, what, you were on drugs. How come you can't remember? He seems to have a clear story. Well, she may have been knocked out, and maybe he dragged her from the bathroom to the bedroom because he was afraid he killed her and he was putting her in the bed. Or maybe she has post-traumatic amnesia for the incident. But either way, if you don't entertain the idea of a brain injury, she's just going to look like an unreliable witness. And IPV support staff, women who sustain brain injuries may be the ones who just aren't quite working, right? They may be the ones that just, aren't working out in the shelter because they're not really doing what they're supposed to do. I gave them 5 tasks to do last week in that meeting, and they haven't done one yet. Well, if someone's just sustained a brain injury, and maybe that's been on top of other brain injuries, it may be hard for them to figure out how to do 5 new things. And so understanding that may make a big difference. And for the women themselves, helping women understand the potential impact of the brain injury and its sequelae has been tremendously powerful for the women that I've spoken to. It's helpful for them to understand that it may be interfering with their ability to function. It may be hindering their ability to escape the abusive situation if they're still in it, unaware of the possible long-term effects. We know virtually scientifically, in terms of data-driven outcomes, we know nothing. Anecdotally, I can tell you stories about women who have sustained repetitive brain injuries and have really unfortunate outcomes 10, 15 years later. And on the flip side, help people understand that there's still hope. And here I can just tell a story. I'm going to actually tell a story in a second about a woman who reached out to me, who we can, basically address this issue with. And that's Lily. And this is like one of the last things I'm going to say, because I think I have a minute. I tried to make things shorter because I know we're a little behind time, but Lily is a woman who was in her mid-40s. Her partner had isolated her, did not let her leave the apartment, literally, smashed her head against doors and door frames for no reason, chased her with a shotgun, and she woke up with a shotgun in her mouth at one point, strangled her to the point that she had petechia, and he made her lie about it. And one time she was on a gurney in an ambulance, and with him hovering above her, the paramedic said, "Did he do this to you?" Well, what do you think she said, right? Basically, he shoved her head and kept it underwater on several occasions, threw her off a porch onto hard, dry clay. 2 to 3 times per month for 1.5 years, she would experience being woozy from abuse, would wake up from being strangled. That happened approximately 10 times. Now, this is a woman who in high school had the reading comprehension of a senior in college. Okay, she was very bright. And at this point in her mid-40s, she was sounding out words because they didn't make sense to her. And she had to go to a dictionary for words that she, quote unquote, read a million times. And it was scaring her to see that this weird stuff was happening. She had horrible word finding difficulties. She couldn't remember names of people she knew well and had relationships with for years. And she would constantly lose her train of thought. She had anxiety and panic attacks for no reason. She was in a healthy, loving relationship. She read an article that she found where I described partner-related brain injuries, and it basically changed her life. And she's doing substantially better now. She still struggles with these issues, but her understanding of what's likely going on. Now, there's no way I can definitively say that all the brain injuries sustained are contributing to these outcomes, but I can say I think it's very likely, and we certainly need to entertain that. I would like to recommend that for those of you who really want to understand a little bit more about partner violence, to look at it's a 10-minute or less TED Talk, Crazy Love by Leslie Morgan Steiner. And this just gives you sort of a flavor of partner violence in a way that I think a lot of people don't necessarily understand it. I'll leave it at that. And then just remember that every little bit of help supports. If I were there in person, I would have come with a sack of bracelets. And that's because my niece heard about my work. She started making bracelets for the women who I work for, basically the women who are experiencing partner violence. And I passed them out free of charge to anyone who is a survivor. And then my son, who knows about my work, basically decided that he was going to have a fundraiser made to support women who have experienced brain injuries, because women should not be hurt like that. And he raised $300. And this was like a dimes for dollars fundraiser where they're expecting to raise like $30 or something like that. So with that, I will say IPV-related brain injuries are very common, they're dangerous, and it is our job to recognize and intervene. And thank you very much for your attention.
Thank you, Eve, for this great illuminating, very, some ways distressing talk. So
I apologize. It is,
yeah.
but we need to, and that's why I try to warn people. But I think that when we don't talk about it, it perpetuates the problem even more. And sort of a philosophy is get comfortable being uncomfortable, because that's where we need to be to address this issue.
Yeah, no, I completely agree. I'm gonna send one question your way. It's somebody's wondering on, what skill set to have this kind of conversation screen with our clients. Do you have any suggestions on what people could use to try to address this? As we had discussed previously, I know in my clinic, I rarely get referrals on this. So are there any tools that you know of that, people should be incorporating into their practices to try to understand if this is happening to their clients?
Well, I mean, it depends on who you are, right? I mean, like for you, Carmela, I mean, you might just start regularly asking people, just say, this is a new area of research. And so we just regularly ask if people have experienced, well, I don't say brain injuries from your partner. What I say, and it depends on how much time you have it, sorry, but I say, like, after anything your partner did you ever lose consciousness or black out? Or did you ever get really disoriented or have memory loss? And if they say, yeah, and you say, yeah, you know what, that could be a concussion, that could be a mild traumatic brain injury. And if that happened a lot, then you could say, well, I mean, if it happens once, I think we know that one concussion or mild traumatic brain injury. Now, some of these women do sustain moderate to severe brain injuries, but by the large majority, it's repetitive mild traumatic brain injuries. And so they can go unrecognized, right? It's a lot easier. But you can, if you have one, it's probably going to be okay for the most part. But when you start having repetitive brain injuries, we know that that's where we're starting to get into a more dangerous situation. And if you know something like that is happening, or just say, do you feel safe at home? Have you been in safe relationships? We're realizing that a lot of the problems that people have experienced or people are experiencing are from abuse they sustained from relationships where they should have been safe in, but weren't. And this is actually remarkably common. So we just kind of check in with that now, because we want to understand all the potential factors that may contributing to, people's problems, if especially like when you say if there's a brain injury or something. In terms of just talking to friends, I mean, it's a matter if you want to identify IPV or if you want to identify brain injury. But even just identifying the IPV part can be huge, because then it can open that conversation and then you can go further. But one of the things I tried to allude to in the talk was that COVID, if you want to find a silver lining, so you can say, man, like I've been reading these articles, COVID has really increased rates of partner violence or domestic violence, whatever term you want to use. A lot, and I heard this really like hidden. So I'm checking in on all my friends. I just want to make sure, are you safe? I just want to make sure that I'm checking in and making sure people have the opportunity to talk about this. And so that's how to open up the conversation about partner violence. And then you can go further and you say, like, has he ever put his hands on your neck, or has he ever hit you in the head? And then from there, find out more.